for the rest of us, right now today, we had this winter wonderland. It was so pretty yesterday watching the snow fall. But with that, in the middle of the winter months, there are a lot of issues that can come with that as well. Dr. Ronald Lederman with us. He's the orthopedic surgeon and sports medicine doctor for the Center for Orthopedics and Sports Medicine. And good doc, we were talking before during the break. I have a big dog, and being able to walk the dog, you don't realize how many injuries could happen because of the ice that is out there right now. And when you have a dog that pulls you, I have taken a tumble or two recently, and it's not so pleasant.
It's not uncommon either. I can tell you, interestingly enough, my daughter, who lived in Chicago, had an orthopedic injury, needed knee surgery, and this was 2 days after she got an English mastiff puppy. So already this puppy is 35, 40 pounds, big and strong. And so we've had a trainer that told us that you hold the leash and then wrap it around your wrist so you keep it not a lot of slack. These big dogs, when they want to go, they can yank your arm out. My sister-in-law, just 2 months ago, walking her dog, like she has done multiple times a day for 10 years, same exact thing happened. So you're right. With this gorgeous snow comes hazards. And whether you're just walking to the car, into a building, people are slipping and falling, and they're sustaining shoulder fractures, ankle fractures, wrist fractures. The only good news I can say is that Lederman-Kwartowitz Orthopedics will get you in the same day. You just call the office, and if someone says, I fell and I think I broke my knee or my wrist, you don't have to go to the emergency room. You can come right to the office.
And see, I would never think to call you first. I would think, oh, I need to go to an urgent care or to the emergency room. But really, and how common are some of these injuries during the winter months here in the state of Michigan?
Very common. I mean, every day between myself or Dr. Kwartowitz or Dr. O'Keefe, who's one of our orthopedic surgeons, Dr. Steve Hyman, who's in our practice, we're seeing orthopedic injuries every day. In the summertime, it's usually from sports, people out jogging. In the wintertime, and we've all seen it, we see people out there hiking on the trail, walking their dogs, probably more now than in the past because of this whole COVID fever. But we see it all the time, and we try and get the word out that, I mean, who wouldn't want to avoid a trip to the emergency room? Forget about COVID, going to an emergency room or a hospital where there are people with COVID, but why spend 3, 6, 9 hours when you can give us a call? We usually get you right in. You're in and out in probably an hour. So we pride ourselves on, like a boutique orthopedic practice where we take great care of everyone in a very timely manner.
But doctor, when do we know when to go to your office or even to an emergency care center? Because sometimes when you're out and you slip on the ice, it may not seem so serious in the beginning stages. You kind of get up and you're limping a little bit, but what should we be looking for to make that decision?
That's a great question. And if you have an injury, if the pain is like, oh my gosh, and you're on the ground and you're rolling and you're grabbing, more likely than not, you did something and it's worth giving us a call. And if nothing else, we bring you in, we get a quick x-ray, make sure nothing's broken. The more common scenario, like you just described, is, oh, I did something, but I'm not sure how serious it is. Maybe I'll walk it off, see how I feel the next day, and that's fine. And even the next day, if there's a lot of swelling, or if you can't put weight on it, or if you can't use your hand or straighten your arm or raise your arm, it's very reasonable to give us a call. We're a judgment-free zone, so there will be no judging. Even when, like my mother did 40 years ago, either with me or my brother, we hurt ourselves, you're fine, don't worry about it. And then a week later, we find out we had a broken bone. When she found out, she felt terrible, but, judge-free zone, no worries.
I love that analogy because there are times like you're like, oh, my wrist hurts or my ankle hurts, and you're always confused. Do you go in? Do you put ice on it? Do you put heat on it? Or do you just go to the doctor?
You want to ice it. If you have an acute injury, ice it, because that keeps the inflammation down. if even with the ice, you're hurting so much and the swelling is still there, give us a call, because even if it's not a broken bone, it could be a strained or partially torn ligament. And it might be something as simple as putting on a cast in the office or just putting on a removable brace. But you want to know, and it makes sense, and we're there to check it out. People, what I don't want people to do is say, I'm not sure, but I'll wait. And then sometimes we'll see someone that had an injury that needed attention sooner, which would have shortened the recovery. But when you wait so long, sometimes that window of opportunity closes.
Yeah, and the longer the injury, the bigger suffering that you're going to go through, but also the longer the recovery along with that. What's so hard too right now is sometimes when you go out and it's like that black ice, and you don't realize that's on sidewalks as well. And so you need to be really careful at this time of year when you're going out. But beyond slip and falls, what other injuries or what other activities from some of these athletes are you seeing right now at this point in time?
Well, I'm part of a biking group, which is a wonderful community, which is based on outdoor activities, which we love. And now a lot of my biking buddies have gotten what's called fat tire bikes. And you'll see them on the West Bloomfield Trail or around, where they are, these big tires, almost looks like a mini dune buggy on two wheels. And people can go down. Whatever you do, you have to be careful. Of course, Pine Knob and Alpine, the different ski resorts are open. And common injuries are ACL tears of the knee, or if you fall and you go to grab yourself and you can hurt your shoulder. But you know what? At Lederman-Kwartowitz Orthopedics, we're big believers in getting outside, enjoying life, staying healthy and fit. And our goal is to, number one, get people better faster, which we do with our on-site physical therapy. They're incredible. We have alternative treatments like laser treatments, regenerative stem cell treatments, PRP, which is the plasma-rich protein. Tom Brady, who just got to his 10th Super Bowl, which is crazy, he made PRP, plasma-rich protein, very popular about 10 years ago when he did it on an Achilles tendonitis. So there's a lot of things we offer that have nothing to do with surgery. I mean, our goal at Lederman-Kwartowitz Orthopedics is to keep you out of the operating room. And that's truly the way we believe.
Hey, I know I've heard. Oh, no, go ahead. So, Doctor, you froze up just a little bit there, but will ask. I know some of my friends, when they've had some of these injuries, frozen shoulder syndrome and other such things, sometimes a steroid shot or some type of shot can help with those injuries as well, right?
Absolutely. So one thing we've done at Lederman-Kwartowitz is we invested in technology where we have an ultrasound machine that can go into each exam room, and we use the ultrasound machine to look at the rotator cuff to see if we think there might be frozen shoulder, rotator cuff impingement. And if someone has so much pain they can't raise their arm, we use the ultrasound guided cortisone injection to put it right where it needs to be. And it allows us to use a smaller needle. People love that. Small needle means you can't even feel it. And then we get them into our physical therapy, which is right there. That's the key. One piece of advice is if someone has pain in the shoulder in particular, but any joint really, and the pain is preventing them from using it normally, that can lead to a stiff or frozen joint. Don't sit on that. Come in, get evaluated, get a short course of therapy, and avoid what you alluded to, a long, protracted, and really uncomfortable recovery. Let's get people better faster, quickly.
And plus, that can help prevent surgery down the road as well. Because I had frozen shoulder years ago. Like I couldn't even lift my arm to wash my hair. It is so painful, and until you go through it, you don't understand what exactly it is. But physical therapy and some of these cortisone shots, the treatment is so important to help you avoid surgery.
Yes.
And with that too, so for people who could be klutzes, kind of like me, is there a proper way if you feel yourself falling? Is there a better way to fall than other ways, so that to help you prevent serious injuries?
That's really interesting. In our physical therapy, at Lederman-Kwartowitz, we have a gait training program, a gait stability, balance, anti-fall plan. And if someone's going down, the people that know how to fall the best are people that have studied judo. Because in judo, you're taught how to hit the mat and roll when you're flipped. So the most common instinct is to reach out with your hands, and hence wrist fractures. But if you know how to fall and roll and impact the fall, that is important. I'm not sure where I froze up earlier when we were talking, and I don't know if it was when I was talking about the non-surgical treatments like injections.
Mm-hmm.
I don't know how far I got or what you heard about the alternative forms of treatment, the laser, plasma-rich protein, stem cell, and these are things that can help avoid surgery. And if you come to Lederman-Kwartowitz Orthopedics, every one of our doctors will do everything we can to keep you out of the operating room with all of these different alternative forms of treatment.
And it's about exploring your options. And doctor, with that too, can you talk a little bit about telehealth? We're hearing so much about that right now during the pandemic. Is your office offering that? Because how do you really do that with physical therapy?
That's what I was asking myself, but I'll tell you something really interesting. Yes, I think within 1 week of COVID hitting, we converted to telehealth as an offer. Now, we have taken such extreme measures for the past year to keep the office clean, safe, disinfected with the hospital grade materials. And we haven't had a single case of COVID that originated in the office or passed in the office, which is pretty amazing. I will say, so the short answer is yes, we do offer telehealth. I didn't think it would work with physical therapy, but some of the happiest patients were getting their therapy online with our physical therapy director, Jennifer Simmons, who, if anybody's been to our PT at LKO, they know her and her team. Surprisingly enough, it works. It's really amazing. But I will say this, a real message of hope. I am so hopeful that now we are seeing the light at the end of the tunnel. I mean, we have not being political, but you can already see that with leadership working cohesively with people, the rollout, it's all going to be a team effort, which is so welcome. And I was at Ascension, Providence Health, getting the vaccine. At Lederman-Kwartowitz, just about everyone in our office has been vaccinated, at least with the first one. And to see everybody getting vaccinated, you know, when was it we were saying, oh my gosh, we have to get through 6 months of the horrible Michigan winter? Well, now we're at a 2-month countdown. Meanwhile, millions of people or hundreds of thousands of people are getting vaccinated. So mark my words, in 2 months, come April, sun is shining, we're in the 40s and 50s, maybe 60s, hundreds of thousands, maybe millions of people are vaccinated. We're getting close, people, and it's working. But in the meantime, you can feel safe coming to us. If you prefer telehealth, we can offer that. And I think we're all going to get through this finally, once and for all.
Well, we are going to leave you on that message of hope. Your outlook is very infectious as well. So thank you so much. But quickly, before we let you go, good doc, can you also share with our listeners and our viewers how they can contact your office if they do have an issue? And also, you know, keep in mind offices such as yours if you do have a spill on the ice right now.
Well, first of all, phone number is the best way. We have people answering the phones, live people, hopefully. It's 248-669-2000, 669-2000. And if you have an acute injury and you're really hurting, we'll do everything we can to get you seen that day if it's possible, certainly by the next day. And then Lederman-Kwartowitz.com or LKO.com, I believe. But the best thing is to call our office, 669-2000.
Well, Doc, I live on the West Bloomfield Trail, and we look for you riding your bike out there behind us. We want to say thank you for your time, and Happy New Year to you and your staff as well.
Thank you to you as well. Healthy, happy, and the sunshine is coming.